Hello, I'm Neonita Kisha. Today I'm going to present about reproductive health service in Republic of Vanuatu, a Pacific regional country near Australia. So welcome to my presentation. Well, my source or reference is a journal article which published from International Journal for Equity in Health, and it published at 2011, and it is about wealth inequality and utilization of reproductive health service in the Republic of Vanuatu. The insights from the multiple indicators cluster survey 2007, and the main author is Masud Rahman and others from the different countries. Let's start this with the aim of their research. Yes, the aim of the research is to examine the degree of inequality of reproductive health service in Vanuatu on the basis of wealth inequality and utilization. Basically, they try to find out significant barriers of maternal health care access and utilization, followed by impact of maternal mortality, and they also wanted to identify what should be improved for reaching Millennium Development Goal 5. They had conducted this research by using multiple cluster survey data based on the responses from 615 ever married women and having at least one child below 2 years. Well, this paper authors use some social determinants and health inequalities to analyze reproductive health service of Vanuatu. Here they talk about access and availability of health service of the 615 women and their educational status, their financial and social status, their language and religion, and also their age of marriage, which all are the factors of social determinant of health. And based on these factors, they mention some health inequalities between poor and rich women. Educational status become a factor for health inequality, and all women did not get consultancy about HIV/AIDS or tested by the medically trained personnel due to financial lackings or lack of education. Author describes social disparity based on wealth index analysis, where they divided them within 5 groups, same as maternal education and maternal age, and also place of residence, where social inequality visible between rural and urban women, also poor and rich women, as well as educated and less educated women. In this paper, they measure health outcomes within 5 variables. Significantly, social disparity affected their health outcomes, such as rich women can get more access into counseling service or tested for HIV/AIDS than the poor women. Also, these differences between urban and rural women. Women who belong to good socioeconomic status household, they can access more reproductive health service utilization. Authors showed that in wealth disparity and utilization of reproductive health service have significant differences between poor and rich women. They address this result by analyzing statistically, and they also use SPSS data analysis software for that. In their adjusted model, they analyzed odds ratio and confidence interval and found that there have significant inequality in different 5 health outcomes between poor and rich women. Well, I think I can rely on this evidence because they used multiple indicator cluster survey data, which is a government data, so it is reliable, and therefore conducting interview ethically informed the respondents, but it is not a written consent, which is negative. Additionally, they also identify some biases in this research, that is possibility of recall bias and possibility of response bias. However, they try to minimize those biases. Even they identify that wealth index can be divided 3 or 4 rather than 5, and then they could get different significant result. The survey conducted after 2 years given birth, so there have possibility that women who died after giving birth within 2 years, and their data also not included here. So there would be possibility of change the result. In the analysis, they don't include occupation of the woman. So I think it is also gives new insight of the result, even though it is a quite reliable evidence for Vanuatu as well as for specific regional condition of reproductive health service. Yes, author makes a recommendation that before going for intervention on reproductive health service in Vanuatu, there should be needed to address 4 raised inequalities in health service utilization. Of course, they justified all the things in this article. Based on these research findings, health professionals can develop an intervention protocol for community-based settings. So, what types of intervention would we provide? It must be targeted improving access to health service. Increasing community engagement show that program will be more acceptable in community level, and take steps for capacity building for increasing skilled person within community level, and it will make them financially confident. Increasing technological support for making more acceptable and reliable for community level. Awareness building campaign can be increase their knowledge about HIV/AIDS, and they can accessing more these facilities. In this program, health professionals must have to collaborate with government as well as other governing bodies such as educational institutions and different level of health service professionals. Well, I think it is transferable because in the developing country of other Pacific regions would be situation would be same more or less. Of course, result will be different, but health professional can use this idea and make more successful program in other settings. So thank you for listening my presentation, and if you want to ask related this article, you can comments me and I will try to answer all your questions so far.